Morning is Dr. Rafid Vet Triage, December 29th, Sunday, 2024. It is 12:03 p.m. Pacific Time. We are continuing through this issue of JAVMA from February 15, 2017, and we're going to be talking about this paper here. Boom. A systematic review and meta-analysis of the association between Mycoplasma species and upper and lower respiratory tract disease in cats. This comes out of the College of Veterinary Medicine, University of Illinois. So the results of the study show that there was a significant association between isolation of Mycoplasma organisms and upper respiratory tract disease in cats, but not with lower respiratory tract disease. The association between upper respiratory tract disease was only significant when conjunctival or pharyngeal samples from non-shelter cats were analyzed with a Mycoplasma felis specific PCR assay. In conclusion, the results suggest that Mycoplasma felis may be a primary pathogen in cats with upper respiratory tract disease, warranting treatment. The environment was important to consider when interpreting Mycoplasma positive samples because of aclinical carriage, especially in sheltered cats. Further investigations are needed. So, just a recap here before we go into the details. They're saying here that there is an association between Mycoplasma and upper respiratory tract disease. And I think most of us would agree with that. Clinically, that's what we end up seeing. There was not that association with lower respiratory tract. Sorry, if I said it's supposed to be upper respiratory tract, not urinary tract. The association between the upper respiratory tract was only significant if you tested the conjunctiva of the cat or the pharyngeal region, and and that was only significant when you looked at non-shelter cats, and only if you looked at PCR testing. So shelter cats, it wouldn't be a significant finding there necessarily, and if you use bacterial culture and sensitivity testing, it may not be as accurate. So let's go to introduction here. You can use, you can culture bacteria, and that's often found to be recovered from samples from both healthy and sick cats. And that's the problem, is bacteria like Mycoplasma can be found in normal cats, and it can be found also in cats that have illness. So the question is that bacteria the cause of the illness, or did something else set up the reason why they developed the bacterial infection? Primary respiratory pathogens. So primary respiratory pathogen means those bacteria, those pathogens, that the primary, meaning that they are the initiator of the infection, versus a secondary pathogen where normally by themselves they don't cause an infection, but if something happens to the local environment, let's say you have pharyngeal trauma, then that sets up the stage or the environment where that secondary pathogen can now cause infection. So primary respiratory pathogens in cats include Bordetella bronchoseptica, Chlamydophila felis, and Streptococcus canis, in addition to Mycoplasma species, which have also been found in not only respiratory but also non-respiratory diseases such as osteoarthritis and pneumonia. Tracheobronchial lavage fluid of sick cats can be tested, and most authors agree that Mycoplasma species are pathogenic in the lower urinary tract of cats. And that, of course, is different than what the study is finding. Mycoplasma organisms have been isolated from the upper respiratory tract of healthy cats in some studies. However, Mycoplasma are recognized as unquestionable upper and lower respiratory tract pathogens in other species, including poultry. And some examples include Mycoplasma melagridis, or in tortoises, where it's Mycoplasma agassizi, or in pigs with Mycoplasma hypopneumoniae, and in people with Mycoplasma pneumoniae. So regarding review question and literature selection, the review questions for this study was developed according to the PICO, which is Population, Exposure, Comparator, and Outcome format, for assessing the effect of an exposure on a disease. So the population for the P part of PECO was cats with clinical signs of upper or lower respiratory tract disease. The exposure was identification of Mycoplasma organisms by PCR bacteria culture from the respiratory tract. The comparator was cats without signs of respiratory tract disease, and then the outcome was samples that were positive for Mycoplasma. 7 indexing and abstracting services were used in August 2014 from PubMed, Scopus, ISI, Web of Science, EBSCO, ProQuest, Google Scholar, and the Cochrane Library. As far as data extraction goes, number of cases were collected, number of control cats collected, number of samples that were positive for Mycoplasma, whether they had upper or lower respiratory tract disease, how the diagnosis was made, the anatomic site from where the samples were collected, the diagnostic method chosen, either PCR or bacteria culture, the Mycoplasma species that were identified, and were the cats shelter or non-shelter cats. Results: study selection and characteristics. A total of 2,002 articles were screened. Only 12 fulfilled the criteria, but one of those 12 were were considered 4 different studies. So they actually had 16 studies included in this paper. 13 studies compared the rate of isolation of Mycoplasma from the upper respiratory tract between case and controlled studies, or case and controlled cats. Median number of case cats in these studies were 61. Median number of control was 64. In half of the studies, case and control tract cats were in a shelter. Bacterial culture was in 3 studies. PCR was in the remaining 10 studies. And they tested any combination of conjunctiva, pharynx, and nose. 3 studies compared the rate of isolation of Mycoplasma organisms from the lower respiratory tract. In 1 study, cats were housed in a shelter environment. 2 studies used bacterial culture. 1 study used PCR. 1 study used bronchoalveolar lavage. 2 studies used bronchial brush from samples from necropsies. The risk of bias assessment. The signs of respiratory tract disease include sneezing, nasal discharge, oral lesions, ocular disease like discharge, blepharospasm, and conjunctivitis, or some combination of those conditions. Pathologic role of Mycoplasma species. There was a significant association between isolation of Mycoplasma organisms and upper respiratory tract disease, which had an odds ratio of 1.65. Isolation of Mycoplasma was not found to be significant with lower respiratory tract disease, odds ratio 1.56. A significant association between isolation of Mycoplasma and upper disease was not identified when culture was used as the diagnostic method. A significant association was found between Mycoplasma phyllis and upper disease when a PCR was used. A significant association between Mycoplasma phyllis and upper disease was identified for cats in a non-shelter environment. Okay, discussion. Results of the present meta-analysis provided evidence of a significant association between identification of Mycoplasma phyllis and upper respiratory tract disease in cats, although the strength was only considered mild. On the other hand, isolation of Mycoplasma was not found to be significant with lower disease. For the present analysis, odds ratios were used to measure the strength of association as recommended for controlled cross-sectional studies when the incidence of the disease following exposure is unknown. The odds ratio represents the number of Mycoplasma positive samples divided by the number of Mycoplasma negative samples versus control cats. In Mycoplasma phyllis, if Mycoplasma phyllis were a normal inhabitant of the upper respiratory tract, it should have been isolated from both case and controlled cats with the same frequency, resulting in an odds ratio of 1. For example, odds ratio for association between Pasteurella multocida, which is a commensal organism, and upper respiratory tract disease in cats has previously been reported to be 0.8. Commensal means that the pathogen lives inherently in that individual's body. Importantly, the significant association between identification of Mycoplasma organisms and upper respiratory tract disease could be either causal or consequential. Consequential means that the Mycoplasma phyllis overgrows a mucosa that's been damaged by a consequence of upper respiratory tract disease. However, the odd ratio would be expected to be higher if this were the case. Indeed, the fact that many cats with upper respiratory tract disease in studies selected for analysis were not positive for Mycoplasma would argue against a consequential relationship. given that there are many other known causes of upper respiratory tract disease in cats, at least some of which being likely more common than respiratory mycoplasmosis. It was not surprising that the present study identified only a mild but significant association between identification of mycoplasma and upper respiratory tract disease. So they're saying there, I think, that in upper respiratory tract disease, although mycoplasma could be a problem, more commonly identified organisms should be looked for. Because mycoplasma organisms lack a cell wall, they are resistant to antimicrobials that act by disrupting bacterial cell wall synthesis, such as beta-lactams. If Mycoplasma fellis is the causative agent of upper respiratory tract disease in mycoplasma-positive cats, these cats would be expected to respond only to doxycycline, unlike mycoplasma-negative cats. Doxycycline is more efficacious than beta-lactams when treating shelter cats that have upper respiratory tract disease. A significant association between isolation of Mycoplasma species and upper disease was not identified when bacterial culture was used. On the other hand, there was significant findings when PCR was used. A higher sensitivity of PCR may be the reason here, and the PCR may not be affected by the death of organisms either during transportation of the sample to the lab or after treating them with antimicrobials. The difference may be attributable to the Mycoplasma species targeted by each technique as well. Other Mycoplasma species found in the upper and lower of cats include Mycoplasma gattae, Mycoplasma aeruginoe, Mycoplasma pulmonis, Mycoplasma arthritis, Acolaplasma latilaui, and rarely Mycoplasma fulminatum. Mycoplasma gattae, for example, has often been associated from healthy cats and may not be associated with disease. In the present analysis, a significant association between Mycoplasma fellis and upper respiratory tract disease was not found for cats in a shelter environment. It suggests that the rate of aclinical carriage may be higher in shelter cats as a result of strong exposure. Higher rates of aclinical carriage in community cats than in household cats have been demonstrated for other upper respiratory tract pathogens such as calicivirus. The percentage of oropharynx samples from healthy cats in houses positive for calicivirus was 8% versus 24 and 48% of healthy cats and colony cats, respectively. Although Mycoplasma pneumoniae is considered a major respiratory factor in people, aclinical carriage was found in kids. In these kids, Mycoplasma pneumoniae was interpreted as a subclinical pathogen rather than a commensal organism, because its isolation from the upper respiratory tract was always followed by clearance within several weeks. Identification of Mycoplasma fellis in a sample from the upper respiratory tract of a non-shelter cat may be indicative of true infection, and you can consider treatment. However, aclinical carriage may be suspected even in non-shelter cats if the upper respiratory tract disease has been occurred recently in a household or if the cat has recently been adopted from a shelter. Mycoplasma fellis behaves similarly to Mycoplasma pneumoniae. It could persist in the upper respiratory tract for up to 3 months after infection. On the other hand, findings suggest that identification of Mycoplasma fellis in a sample from a shelter cat does not necessarily imply that the organism is causing disease. The present meta-analysis failed to find a significant association between isolation of Mycoplasma and lower respiratory tract disease of cats. In conclusion, findings of the present critical review and meta-analysis suggest that Mycoplasma fellis may have a pathogenic role in upper respiratory tract in cats, and treatment may be warranted in those cats, especially if they do not live in a shelter environment. The findings of this meta-analysis suggest that aclinical carriage should be considered, especially for Mycoplasma positive cats who live in shelters or in houses where recent environmental incidents of upper respiratory tract disease occurred. So the 3 bullet points I'm gathering from this is that you prefer PCR testing over bacterial culture. If you do have a Mycoplasma fellis positive cat with upper respiratory tract signs and they are not in a shelter and there's been no recent infection in the household, then you should treat them. If you have Mycoplasma fellis with upper respiratory tract signs in a shelter setting or it was recently cleared from a household, you don't treat them. And then Mycoplasma does not necessarily cause lower respiratory tract disease. The key point here really with this study is individual tailoring of treatments. You have to think about it and say, okay, well, I have a diagnostic that's positive, but is there a possibility that this is a clinical infection or a commensal organism, for example. So pretty cool. It's one of those conditions that are very difficult to treat, difficult to diagnose, and multifactorial, because you don't know if these cats have other concurrent bacterial infections or viruses or what have you. So it's a challenging one. So, all right, we'll be back tomorrow with another one. We'll talk to you guys then. Bye.